Okay, so hello everybody. So my name is Craig and I work here with SIT, the School for International Training, and we're just gonna get started today. Thank you for joining us with our alumni panel, where we're gonna be hearing about a variety of SIT alums who have participated in programs in the field of global health. And so this is part of our SIT webinar series called Critical Conversations. So obviously many of you are already familiar with SIT and or have a little bit of background with what our institution is about, but just for those who don't, so SIT is obviously the School for International Training, and so we are an accredited nonprofit college based in Vermont. But even though our headquarters are up in Brattleboro, Vermont, we run academic programs all around the world. And so it's really a global institution. There are two main divisions of SIT, the SIT Graduate Institute, which runs academic programs at the master's and doctoral level in a variety of international fields. And then also the division that we're going to be hearing about from today is SIT Study Abroad, which runs a really diverse range of academic programs, education abroad programs all over the world in about 35 countries. And every year, SIT takes students to all 7 continents of the globe. And so, yes, that does include Antarctica. And so as we've discussed, throughout different activities this week, and as you may know, if you're already familiar with SIT, all SIT programs fall into what we call critical global issues. And so these are major challenges that transcend borders and that affect everyone on our planet. And the issue that we're discussing this particular week as part of this series is the field of global health, which of course, in light of the present pandemic, is something that's really at the forefront of so many discussions taking place. And so, as I said, my name is Craig McDonald. I work for SIT. I've been with SIT for about 6 years total now, both in our admissions division and now doing public relations work. And I'm joined by my colleague, Joan. Joan, if you'd like to just introduce yourself briefly.
Yes, I'm Joan Tiffany, Senior Director of IHP, which is the International Honors Program, a comparative global study program for college undergraduates around critical issues or timely issues. IHP has been around since 1958-59. I've been with IHP based in Boston since 1984, which is a very long time ago, I realize. And look forward to the conversations that we're having today around health issues, and joined by Kahari Kenyatta, who's an alum of an IHP health program. We can't hear you.
If you could take a moment to introduce yourself as well, and then we'll go through all of our participants too. Just, like where you're from, what's the school that you went to while you were a student with SIT, and where are you located now? What's the program that you went on to while you were with us?
Absolutely. So my name is Kahari Kenyatta, and I currently live and work in Washington, D.C. as an associate with a mission-driven consulting firm called Waxman Strategies, working on health issues. But I came into the SIT IHP family back in the fall of 2014 on the Health and Communities program, traveling to India, South Africa, and Brazil. And after graduating from the University of Pennsylvania in 2016, I came back into the family to help out as a field assistant for the Washington, D.C. launch of an IHP program that year.
And on the way it's displaying on my computer, I see Haley, you're next.
Great. Yeah, I'm Haley. I'm originally from Washington State, and I went to Whitman College for my undergrad, graduating in 2017 in anthropology, and I participated in SIT Chile, Public Health, Traditional Medicine, and Community Empowerment in spring of 2016. And immediately after graduating, I was a Peace Corps volunteer in Cambodia for 2 years, and then came to where I am now at Yale School of Public Health, where I'm getting my master's in public health. So I'm in my 2nd year, and I'm in New Haven, Connecticut right now.
And then last but not least, Elizabeth.
Thanks, Craig, and hi, everyone. So my name's Elizabeth. I grew up outside of New York and then went to Williams College for undergrad. I studied gender studies and public health, and in the fall of 2015, in my junior year, I went on the India Public Health Policy Advocacy and Community program, which has a slightly different name now that potentially fact check later. And then immediately after graduating, I did a Fulbright Nehru Fellowship, continuing the research from my SIT ISP back in northern India. And then I worked clinically in the US in sexual and reproductive health for a bit. And now I work at a social innovation lab doing maternal health research and policy coordination while I'm applying to grad programs to become a nurse midwife.
So thank you all so much again for being here to just share a little bit of your SIT experience with us. For those of you who are participants, you'll see on the right-hand side of the screen there is the chat feature, and so please, throughout this, feel free to type in questions that come to mind, whether it be for the group as a whole or from a specific participant. We're going to dive into a couple of just general questions to get the ball rolling, and then certainly we look forward to engaging in a discussion and hearing from our attendees about their own questions. I guess to get started, a sort of general question for our participants, and maybe we can go through one by one and just have a dialogue. What was it really that drew you to the field of working in public health? And then specifically, why study abroad in the field of public health, and why an SIT program and your particular program? Whoever feels the spirit move them.
This is going to be the weird touch and go that's even more complicated over video. I can start, but I got really interested in public health when I was actually pre-med when I first started college, and I quickly realized that being pre-med meant a lot of science classes, but it wasn't talking about the social issues and inequities and issues of social justice that I was actually passionate about in the field of healthcare. So public health was a perfect niche for me to actually engage in those conversations at the undergrad level. And then I chose SIT and my country program by showing up to my study away office at my college and saying, I want an experiential program. I want it to be about public health. I want to do research in a new language, culture shock. I want all the things. And then my advisor just handed me the SIT India booklet and said, this one's for you. And that was the only one I applied to, and I got it and it went. So it was very much, it kind of checked all my boxes, and I hadn't done too much research or insight into the programs before. And now in hindsight, hearing about all the other study abroad opportunities or things like that, I'm so grateful I did SIT and this specific program, and I'm excited to talk about it more. But yeah, very, very grateful.
I could go next. So similar to Elizabeth, I did enter undergrad, with my eyes set on medical school. And I remember sitting in a medical sociology class, and I am a child of immigrants from Jamaica, and my family is all across the east coast of the US, and with a lot of family still in Jamaica. And to be sitting in class and to see the sort of differences of my family play out in the data, whether that be on income, whether that be related to educational attainment and related to place, and seeing all of that play out in the health outcomes within my own family, I just knew that public health was where I really needed to be, and speaking to the social determinants of health and thinking about that broader, more systemic impact. And I knew I wanted to touch and work on something bigger than just the clinic. So in terms of finding my way to IHP, I actually had a friend who had heard about the program, and for years before she came to college, she was excited to do it. She was focused on the cities program, actually. And the funny thing is, she ended up not studying urban studies and didn't find her way to the program, but she did introduce me to it. And once I knew that public health was the road and the path I was on, I knew that IHP would be just this fantastic way to see those interconnected systems just right in front of me, and bring what I was learning in the classroom out into the world, and to just see it play out and learn how I can work to address some of that.
I'm going to sound like a broken record, but I also came in pre-med, wanting to major in biochemistry, and entering college, I still knew I wanted to do public health. I was like an MD, MPH eventually. That was the goal. But also my second, third years, I found the field of anthropology and medical anthropology and looking more at people's real experiences. I remember sitting in organic chemistry being like, but this doesn't connect to people enough for me. So I guess we share similar revelations about public health. And so I just found anthropology kind of at my college. And I always knew I wanted to study abroad, also get experiential learning. And so specifically, I knew I wanted to study abroad, experiential homestay. And I knew I wanted to study abroad somewhere I could work on my Spanish. And so kind of the two criteria of Spanish speaking country and health focus. For my university, the only program that was already partnered was SIT Chile. So that's how I actually ended up at SIT Chile. But like that being said, like I got exactly what I wanted: experiential, Spanish, global health. So yeah, that's how I ended up in public health and SIT Chile.
About how did the actual SIT or IHP experience impact your career so far? And in Kahari's case, if you'd outline the countries that you went to on IHP as a part of your comparative study. So shall we start again in the same order? Elizabeth, do you want to go first?
Yeah, sure. So I definitely thought going into my program that I knew I was interested at that point in US maternal health, and that was where I was going to end up, and that this was an opportunity to get credit for school, study abroad, experiential program. I saw research as potentially a cool way that I could interact outside of the classroom with people now. But I didn't think of it in a career way. Saying that, obviously then the program just upended my life and I did this whole research focus, but also a huge global health focus. I think I had been really interested in studying US public health systems, and I just fell in love with studying the Indian public health system and just comparative analyses of government run health systems, particularly in reproductive health care. And that, made me apply for the Fulbright. And continue in that research world, and then continue learning about research in this job now. Before, I still want to go back to school. I still want to now be a midwife, not a physician. But I've realized that research will always be a part of my work, because it wasn't just a means to an end. It felt like, in some ways, as Haley was saying, finding anthropology as that avenue. It really felt like my way to engage with systemic issues and talk about systemic problems outside of the one-on-one relationship you get in healthcare.
So, with me coming into IHP, I was still just so early in my path in public health. So there were a lot of little bits and pieces that I picked up from IHP that started to send me in the right direction. But then other aspects of my experience that I've just thought on more and more, and my thoughts on the future and my career have changed and evolved with that processing. So I think that one thing that came to me immediately was just the love for qualitative methods, for community-based research. To Joan's point, my program was comparative, so I did spend some time in India, like you, Elizabeth. So we were in New Delhi, and then in the northeast part of Uttar Pradesh in India, near the Nepali border. Um, so, and we actually spent some time in a village called Barich, which you might have spent some time in as well.
That's where I did all of my Fulbright research. We have so much to talk about after.
So much to talk about. But yeah, no, I mean, just that those sorts of methods and stepping into a community and understanding your position as an outsider, but identifying those community partners and gatekeepers and taking the time to build those relationships and slowly but surely get to understand some of the systems that are happening in the communities. I remember in Cape Town, South Africa, there was this sort of shanty town just over this bluff, and at the bottom of it was this community of migrants from some of them from Zimbabwe, some of them were just Cape Townians that through development were sort of pushed out and priced out of the neighborhoods they grew up in, and just to gradually learn about those dynamics and similarly, I remember in Brazil just the racial undertones under so much of the politics there, but all of that living underneath this sort of um, facade, you could say, of this, you know, a racial melting pot. Um, you know, a sort of imagined um, concept that we're hearing so much about these days in the States. Um, but yeah, there was just so much that I was able to take from it, and just I just kept searching for more from my experience. I frequently just look back, and I think my experience in IHP still teaches me things today that just helps me sharpen my views of where I'm heading next.
Take
Yeah.
you the next
I'm
3
gonna
years
unmute
to sort
from
it out.
you want to start that again. Sorry.
Oh, sorry.
Yeah, go ahead.
Okay. I think one of the things that we always say is, first of all, we'll take you the next 3 years to sort through your experience, and then it's a lifetime also of, oh, that's what that meant, or now I am really using what I learned 10 years ago or whatever. But Haley, let's hear from you now.
Yeah, I agree. My time with SIT in Chile was just like one more kind of important foundational like building block, and that it was the summer before I'd spent 2 months in Thailand doing an internship that was really impactful. And then at that point, I already knew I was going to be doing this program in Chile for 4 months. And yeah, like tangibly, I also learned like qualitative methods and like am now studying that in more depth at Yale. But in the big picture, my time with SIT really taught me the value of community and commitment, and things like living with a host family for 4 months really shaped my experience, and also taught me the value of just like getting to know people, even in a professional life, like always valuing people and like always being an active learner from people around you. And even things like working on Spanish and being able to speak Spanish. And it's like, I think when you're in a site in global health, it's important to like be responsible to your community and like put in the effort to learn Spanish. Or and that also brought me to Peace Corps in Cambodia, where initially I had wanted to return to Latin America. You kind of have a choice. And then I got sent to Cambodia, which I was also excited about. And I learned Khmer, which I was so nervous. I was like, and I thought Spanish was hard, and Khmer is nothing like English. But just like the process of learning Spanish and living in a host family in Chile, and having the confidence, well, being nervous, but also having confidence to be like, I did it before in Chile, like I will carry with those lessons. Peace Corps was 2 years. So became another important part of my life. But yeah, and I agree. Yeah, really just like the responsibility of, as a student, as a practitioner in global health, just being really critical of your role and your impact, and working closely with community partners in everything you do is like a big picture lesson I walked away with.
So, what I'm sort of hearing now, and I see a lot of nodding heads too, obviously, is that experiences that we have when we're studying abroad then keep coming back to us and keep teaching us. I wonder, like, can you think of, beyond what we've already mentioned too, were there other, like, particularly impactful experiences that really come to mind as highlights of the time that you spent abroad? And then within that, what are some lessons that you keep referring back to, that, in the work that you're doing now, that you keep being reminded of something you learned when you were studying abroad? Like, how does that ongoing learning process, stick with you?
Well, for me, this is also something I was kind of reflecting on while Kahari and Haley were speaking. Uh, One thing that I'm very grateful for that I learned in SIT, or that I feel like was the lens through which SIT presented public health or global health, was more of an anti-colonialist approach and actually learning on the ground from local practitioners. And I think doing public health courses at college in the US, even if you try to be more, even as anti-white supremacy and anti-colonialism as you can be in that field, I realized that when I got to India and started studying, I was waiting for these books by Western authors or waiting for learning about what global health organizations were doing. And it was just such a really important, powerful moment that it was all local, like, educators and leaders and practitioners. So, both at the global institution level, like we had people from WHO who were, Indian nationals who were working in the India offices of WHO, but also, like Hari was saying, in BIDH, working with local healthcare workers or medical leaders, and really learning from the people who were doing the work there, and really not being a Western classroom plopped in the middle of a different country, but really learning from the, like, experts who are the country specific, content specific experts, was something that really pushed me in my research for the rest of undergrad, and then afterwards to really critically question who I was reading, what they were talking about, and just really engage more with global health from local perspectives. And I also think that SIT did a really good job for me of giving you all these tools and equipping you really well from the beginning, of, in kind of a hand-holdy way, almost at the first bit of taking you around, showing what to do, you being in classes, then you shifting into workshops and shifting into a lot of skill development, that by the time it was time for my ISP, I realized getting on, I think I was talking about this with Craig before, but getting on an overnight train to go to BIDH for my month-long ISP, I was like, oh wow, I'm actually fully alone. I'm actually, like, no professor is holding my hand, but I feel equipped not only with the preparation I was given for qualitative and quantitative analysis in the research that I'm about to do, but I can speak in Hindi and navigate my way around. And I feel like I understand cultural norms, and I feel like I'm dressed appropriately. And I feel like I'm going in with a healthy dose of, like, respect, and being more humbled as an undergrad doing this research abroad. And yeah, I'm very grateful to SIT for that.
There's so much there that resonated with me, like, so much. I absolutely came away with this just deep appreciation, and just honestly, like, awe for the power of community. Whether it is a remote, like, rural village in in northern India, or it's just a, an ethnic enclave in the Lower East Side of Manhattan. Just community does so much, and for all the folks from the West going out into the world, or folks from on high in government coming and prescribing to communities can identify what their issues are and what they need and solutions. And I think one of the most recurring lessons for me from IHP is really recognizing that positionality and understanding when it's really just not my place and it's not my moment, and it's time for me to step back. And that's just been such a critical piece of like my theory of change. um I think one thing that might separate me a little bit from you two is that I was so impassioned about global health coming out of IHP. I think with certain experiences, and just seeing how deeply ingrained some issues were, I really realized just I don't have enough understanding in my bones of the social history and the political history of some of these places. And what I realized in turn, and I remember Sherry Lynn would always say, you know, who was the program manager for IHP, you know, the local is global and the global is local. And what I like in that ignorance of these other contexts, I noticed there's so much that I intuit about the American system that I just get. And in that understanding, I said, okay, I've had this incredible global experience, and I love to be able to travel in this way, in this hyper engaged way. But I can do that as a traveler, but my work can go so much further in the American context. And at least for me, that's how I felt. And it's almost counterintuitive, but I think that's one of the best lessons that I took from IHP.
Oh, Joan, you're muted.
Okay, thank you. I think, yeah. One of the other things that, or this relates to things that have already been said, one of the things that we always say and often say in IHP, and surely it's true for SIT, that your questions will be better. You won't learn all the answers, nor should you. And that, but honing your questions is very, very much a part of the learning experience and being able to dive in. Your comments have made me reflect on that again also.
And that's a lifelong lesson. Like, you know, like every step you take, it's just, okay, what am I learning here? What new answers do I have? But okay, what else is there? Like there are always those new questions, and that's certainly what keeps me moving.
Haley, did you have something to add here?
Yeah, yeah, I think positionality is really important and something I thought a lot about while I was in Chile, right? Thinking of, I mean, what are the goals of the program? Who's benefiting? But throughout, but also realizing that SIT, like everyone has to start somewhere in learning about themselves and the world. And SIT, like Elizabeth mentioned, really helps you get to like this place of independence and critical thinking. I think it's like, obviously you have to put in the work and reflection, but yeah, I think I gained a lot from just being somewhere for 4 months, which is both a long time for me, but not very long compared to someone who is Chilean. And recognizing that, I think one of the most impactful experiences was my independent study project, that I studied mental health and depression among the indigenous population who were displaced to Santiago, the capital. So they're from the south of Chile, but the grand majority of indigenous people in Chile have been forced to migrate to urban regions. And while I don't work, my main interest now isn't in mental health or indigenous groups. Like I kind of came to that topic from our excursions around Chile and in Arica, the town we were based out of, and just the site visits and hearing over and over about like these issues facing in Chile, especially in the indigenous population, and the history of colonialism and the Chilean dictator Pinochet and all this like historical trauma over and over. And again, I'm acknowledging like I gained so much from that research. So I interviewed like indigenous healers in the city who had these healing centers, and I interviewed like primary care providers and specialty mental health providers about like, oh, what is depression? Do you see very many Mapuche patients? And kind of the answer was no, like depression is really different for indigenous people in Chile. And that was also grounded in other evidence. But I learned how to, I don't know, like I tried to be a listener and like do my own research around what I heard. And I think for me, even the studies, the lit review I did around all that, like has really shaped how I now think about social justice and historical trauma and all of that. And I also had a breakdown on one of my days. The first day I was like going out to interview, I was going out by myself. It was Santiago's huge. There was a taxi strike. I was late. All of this. And for a moment, I thought like, oh my gosh, I can't do this. It was like the first day I was supposed to do an interview. And I was so nervous, and everything was in Spanish, which I didn't be speaking for 3 months, but still. And then my advisor, SIT, helps individual students find advisors in that content area for your independent study project. And he showed up off the bus at that exact moment. And really just that one day he helped, we did these interviews together. And from the rest, I was able to do them alone, and with his guidance, develop the analysis. And so like, it was a really good balance of independence, but then also like having that support when you need it.
Great comments. Yeah, I think these experiences, and sometimes the hardest parts, are the times that you learn the most, and it really builds confidence.
We do have a question came in from an attendee from the University of Maine, and she wanted to know for the group, have any of you used the networks that you've developed from studying abroad, and have those influenced your career path? Have you, inferring, have people that you met through study abroad, somehow influenced, different job opportunities or research or academic interests or things like that, both during the program and then since the program?
I may be a very bad example or a very good example. I don't know which, because I very much, yes, the academic director of my program, Azim Khan, is the one who started this nonprofit in Bereich, where we go on study abroad, which is where I ended up doing my research and where I ended up doing my Fulbright. So Azimji has been an incredible mentor for me from then to now. We still communicate regularly and check in. But also various professors from the program I still reach out to all the time. And I've been going to so many of their Zoom webinars in IST, which is exhausting. I'll just be up at 6 a.m. on a Zoom call being like, go Dr. Capella. But also in my program, I think that was one thing I didn't expect fully. Like, I knew that professors and contacts that I made in India professionally would be helpful, or academically would be helpful, but also the network of my the people on my program. We were 14 women total, and we still have a Facebook group chat. And I mean, because SIT is so specific issue driven, I was in a group with people who were all interested in, global health, but specifically they were interested in like social justice. They were interested in this mission-driven work. They were interested in approaching these issues from like questioning their positionality and constantly being uncomfortable. So I mean, both sides of that. I definitely got great networks, professionally and personally, out of it.
For me, I think on a professional level, I haven't seen as much connection on that side. I think one thing that might be a little bit different looking at IHP versus SIT is that we are a very mixed group. So some of us have ultimately pursued medicine. Some of us are in biochemistry PhD programs. Some of us are in the healthcare world doing consulting or doing policy or looking at bioethics. And a few of us have stepped out of health altogether. But what is absolutely just forever is the connection. I mean, even in times like this, a few of my peers from my cohort, we quarantined and got tested and got safe and got together last weekend for the first time in like 8 months, and that was just beyond wonderful. And we do still keep in touch. Still talk with my fellow from my trip, still talk with some of the professors from my trip, and the 28 of us are still tight as anything.
Yeah, I also haven't maybe maintained or benefited as strong from the professional networking from my time in Chile. And part of that may be like I moved to Cambodia for 2 years and have kind of changed geographic interests. At one point, I considered going back and developing my ISP into something bigger, but yeah, I have maintained to different degrees my relationships with my peers, and I've definitely used SIT reference, using my ISP as evidence of my like skills and experience. I've definitely used that, but haven't maintained like specific professional connections besides with my country director here and there.
Another thing that I think I hear consistently across everyone is that, obviously global health is more than just doctors and nurses. So that's, I think, a common thing, that I recall, when we meet students who come to us who are interested in global health, that's a very common thought process. That is that, well, I think I'm going to go pre-med, or I think I'm going to become a doctor or a nurse. And then, of course, it goes in all sorts of different directions from there. I wonder, what advice do you folks have, for prospective students people who are studying something in the field of public health, who maybe think that that's the direction they want to go to? What advice might you share with them about the field of global health, and then potentially international education as a component of their education in public health?
I maybe don't have as formulative a response yet. My biggest advice is to do everything you can. I mean, I think the three of us as a sample size, you can see a lot of people come in thinking they're pre-med and go very different directions. And so I think, and also this does, I mean, out of the 14 people in my program, three of them are currently in medical school right now, and 2 are in nursing school right now. Like, just because it's what you think you're going to do. I mean, this isn't to say, ha ha ha, that's not what you're going to, like, we're going to get you and talk you out of that. But I think in this world, you learn a lot more about different opportunities and work that you never could have imagined. Yeah. So things like project coordination, which sounds like kind of a boring title, but ends up being actually really cool and important, and what a lot of people would probably prefer to do rather than going to health institutions for school and doing clinical care. Yeah, I'll pass it off.
Yeah, no, I mean, I think that's right. It's just the level of exposure is just enormous. And I definitely came in with the idea that, this is something I'm really interested in, but I had no clue what that would really turn into and manifest um, in the professional world. So to to dive into the world of global health and get a sense of different types of opportunities that there are, both at home and abroad, touching these different pieces of the world of healthcare, and global health. I mean, it's just like that in itself is just so beneficial. And while again, it may not always turn into a job for you, I think that the networks that IHP opens up, just in terms of getting to meet people and having the opportunity to ask them about what they do and start to get a sense, that sounds interesting. That doesn't sound quite as interesting. But then, that gives you a little bit of information to go off of and, dip your toe into some of it. I always laugh. I remember around the time I was starting to apply to IHP, I had no interest whatsoever in health policy. Yet here I am.
Right.
Yeah, I don't have too much to add, but really just right. Yeah, try different things. And like for me, it was about committing to medical school or really committing to anything. Just be really intentional and reflective based on the experiences you've had and seek out different experiences, which I feel I'm still doing and figuring out where exactly I want to go in public health. So yeah, and I think like international education going into global health is amazing, obviously, but also like Kahari said, coming back to US based healthcare and health policy, just the experience of, and I'm an anthropology major, but just like gaining cultural competency and learning how to value different people, which is something we've all said, is really valuable for everyone. Yeah.
I see there's a question here that came in from someone at the Plymouth State University in New Hampshire. And they had asked, what was it like trying to navigate new communities, such as different major cities? What kinds of safety precautions did you take? I know it seems a number of you mentioned, like that experience of study abroad gave you sort of training in how to navigate a new community. And perhaps could you talk a little bit just about maybe some examples and stories from that aspect of your time overseas?
So I think for me in Delhi specifically, I have a lot of Delhi specific thoughts and comments, but I'll repeat again, we are all women joining this program, and I think a lot of us were really concerned about safety coming into this. And that was actually something that I was like ready to, I grew up outside of New York City, so I was like, I've been around cities before, I'm ready. But I was ready to like, I don't know, I'll be a tourist, I'll stick out, I won't know what to do. And the SIT program really, is ready for that. Like the whole point is that you kind of come into new situations in new cities, and they, like I said, very much handhold at the beginning, until you feel safe. And I think a big part of the SIT program for me was constantly feeling safe and constantly feeling uncomfortable, and those being two things that were both really important. Like the idea that discomfort is actually where learning happens, but if discomfort becomes too much, it can feel unsafe. But SIT creating kind of that home and family so that you felt that safety net, and you could go out and be uncomfortable and learn a lot. I think that was really important. I would FaceTime with my parents and like with my professors, so they would all meet, and they all felt very comfortable chatting with each other. So my parents were not nervous at all my whole semester. But also, this is something going back to before, and the idea of going into a new community and feeling comfortable, and something that Kahari was saying, I believe, about I'm going to lose my train of thought mid-sentence. But about realizing that you will never fully understand the cultural context. I think that for me, coming back on Fulbright even, it became a very stressful realization of, oh my God, in my whole lifetime, I'm never going to understand full Indian culture, at like political systems, healthcare systems, and how can I actually, in an appropriate and not in a recognizing my position, recognizing my privilege, not actually be more harmful in these spaces. And it made me nervous to participate in global health outside of India, even because I was like, well, at least I never know India, but at least here I can speak Hindi and I know a little bit more and I'll be fine. But then this was a long process for me. This is not something I felt immediately after my semester program or immediately after my Fulbright, but I'm realizing that preparation from SIT and from that semester abroad actually better equipped me to enter different cultural contexts and different communities with a level of respect, with a level of understanding my position, understanding my privilege. And I think that is going to be helpful in whatever communities I engage in. Although I really, going back to Kahari and Haley's points, I think that studying abroad has really driven home how much I love studying in the US and how much I love like kind of sitting in the mess that we have and dealing with that instead of looking outside. I mean, looking outside, but ending up back home.
Yeah, like to that point quickly, I mean, there's just so much we can learn from other countries' systems, just though those political and social and historical contexts are so different, there are still like lessons to learn and bring back home. Or vice versa for students of abroad coming here and learning from us. Um, in terms of of safety and moving through new communities, it was interesting for me in particular. I think as especially in India and in Delhi, this will also be Delhi focused. Um, as as a Black person, that was just I think foreign to me, to be a human of African descent in India, where it is so unfamiliar for so many people there, compared to uh, South Africa, where there's this interesting relationship of yes, you're Black, but you're a Black American, and all the contexts wrapped up in that. Um, so yeah, no, it was just interesting to just walk around and be around and see how I'm othered, certainly, um but not like shown bias towards or against. Um and to just I remember walking along the path to the schoolhouse in, gosh, what was it? What was that area called? Jasola Apollo. And that's where the school was in Delhi for us. And I think Elizabeth, your classroom was around the corner from us, like right through that soccer field or something like that. And I remember by walking by the markets right around the corner from that Blue Moon Hotel, and the folks there would just look and stare, and it wasn't the sort of you know, purse clutching that you can get in some neighborhoods in the US, but more of just like perplexity. Like they're just like, who is this very tall man with very tall hair that just stands up on its own? What's going on there? And I think just um, certainly there are moments where, you know, all of our attention was heightened and we're, you know, sticking close together and looking out for each other. But I think that those sorts of experiences and, you know, just as a participant observer moving through a space and watching other people watch you move through a space, there's just so much there that I think was just so fascinating to see and learn from. Um, I don't know if I really got to your question there, Craig, but
Maybe just the one thing I'd add, thinking about security and being new and unfamiliar is, like we've touched on, but just the importance of deferring to the local leaders of SIT, the in-country staff, as well as my homestay families. Like really, right, your hand held more at the beginning, and certainly most SIT students are different from locals in the community and have different secure and are treated differently. So you need to approach security a little bit differently, but really the main approach to being safe is just learning what the norms are. And that was also emphasized in Peace Corps, where I lived with the host family for 2 years, and that was our main source of security is community trust and your host mom looking out for you. So yeah, that's really important.
On that subject, actually, a question just came in from someone at Hampton University. Was there anything particular about the homestay experience that you would share? Like, was it scary? Was it nerve-wracking? Like, was there any learning that came from that specifically? And that's actually a common question I can say that we hear often. Students think about, studying. They're in college, they're living in a residence hall or living in an off-campus apartment, and then they're going to go live in a homestay family. And I think a lot of people envision that that's like moving back in with your parents, or and after having all this freedom, now you don't have that freedom anymore. But of course, we try to emphasize the really positive cultural immersion aspects of that experience, and that's why it's an integral part of all of our programs. Could you perhaps talk a little bit about those experiences from your own perspectives?
I love my homestay family. That was really important for me, and I knew I wanted a homestay family. I think, like Haley was saying, when I was going in, I was like, "Yep, that's an important check off on my study abroad list." And think I knew that being with a family was going to be a lot easier way to kind of interact with people from that culture than being with, I mean, I don't know, staying in a hotel or even staying in a dorm with other people my age. But I mean, I kind of had two homestay families. I did the first part during all my classes, and then during my ISP, I had a different homestay family. And I mean, one of them I'm messaging with on WhatsApp right now. I need to get back to her. And actually, I was her birth doula when I came back on Fulbright. So I think that was so important for me, and it didn't feel like moving back in with my family because I was, for a couple of different reasons. Because it was like a different cultural context, and it was more distance, and I think homestay families get a lot of training on Americans, like privacy or things like that. But also because, both because I think there was like that level of privacy, but also because you are kind of a little more uncomfortable than you would be at home, which I think is once again that good kind of discomfort. And I think that in that space is where you really can learn more and question more. And I firmly believe that if you were to go on an immersion program and you didn't make any effort to go out and leave your house or go out and engage with communities, you already have things built in that you are going to have kind of a life-changing experience, or something that's going to rock your worldview no matter what. But the more effort you put into it and the more you engage with your community, the more you're going to get out of it. So yeah, but interested to hear your experiences.
Similarly, I loved my homestay families. I think that a homestay experience is this fantastic lesson in like or just argument against all the like human nature cynics of the world. Like I really think that people just have this propensity to love and care for others, and just like the how nurturing they can be, and also like just how willing they are to share. When I was in Delhi, I lived with a Sikh family, and when we got back from our rural stay, they were like, okay, please, like, let us take you to Gurdwara, like just experience this, like come out with us. You know, like when we left, about like 2 months later, my host brother in India was married, and like now he has a daughter that is like as old as his baby sister was when we were there, and like we're all connected on Facebook and sharing photos and all of that. And I mean, it like continues forever. Like my host mom in Brazil, most reliable Instagram liker. Like I can always count on her. um, and I mean, like folks in South Africa, yeah, no, I mean, it's just like this lifelong connection, and they want to see you do well, and ask about like like what is this like for you, and same here. I'm saying, hey, like what's new, like my host brother in the rural area in South Africa, Odwa, like he was just so excited about this job he got last summer, and it was fantastic. Of course, the pandemic changes things, and like they're grappling and dealing with that, but just to the connections, they just are so permanent. It's just like this special experience that doesn't really go away, and they are just your friends on the other side of the globe that
Your family.
you grow up, your family.
Extended family.
Yeah, and you grow up and you watch them grow up, and it's a beautiful thing, I think.
Do we have time, or are we out of time? Should I?
Okay. Yeah.
Yeah, I agree with all of that. I will say I was nervous. I was really nervous to live with a homestay family, and for it to be all in Spanish. And yeah, it turned into a highlight and like really cornerstone. I think SIT has it right. Like it really is the cornerstone to what you learn and what you bring home from your classes. And my host family would take me down. We'd watch YouTube for hours because they were showing me Chilean music, Chilean musicians, and I had one main host family, and then I stayed with 3 other host families for 2-week-long excursions to the Andes and southern Chile, and then my 1 month in Santiago. And so I really had this home base, this home family, and then it was amazing to stay with a family for a week. Because then you even got to know this small Andean town even better. You really got all you could out of that week. Yeah, and then in Peace Corps, I did it all again. I showed up to my Cambodian host family without speaking any Khmer, 0, and that was nerve-wracking as well. But it turned into a very similar experience of having a second, third family that watches out for you and cares about you.
So we're obviously just coming up on the end of the hour now. Thank you all so much, obviously, for sharing your perspective with us. And thank you to our guests for questions that they've been asking. I guess just to wrap things up, is there any sort of burning comment that any of you feel, as far as, global education and global health are concerned, something that, you would just like to sort of end that discussion with, from your own experiences? And it's okay if not, because we've discussed a lot of things too.
I will just say, real quickly, I mean, the sort of experience that I had on IHP is unlike anything I imagined that like I would be able to experience. And given the opportunity, you should absolutely take it. It is unlike anything else. And if this webinar like didn't make it clear, like it echoes with you for a lifetime.
I would just add to everyone, thank you so much. Bravo. It's been such a pleasure to be a part of this conversation. Thank you. And I wish that we were all gathering for dinner or lunch or whatever in person, and hope that day will come sooner rather than later. But in the meantime, thank you.
Yes, thank you to all of you. And obviously, please keep in touch with SIT, and we hope to see you in person, hopefully, at many future alumni events and conversations. Obviously, your study abroad with SIT was just the beginning of your relationship with us. We're all part of this global family, this global learning community, and we're thrilled that you're a part of that, and that you're continuing to have the experiences that you're having. And that what you've learned with SIT is sticking with you throughout your lives. So thank you so much again for sharing your experience with us, and thank you to all those who have participated. And please, of course, stay tuned to the SIT Critical Conversations webinar series at sit.edu/critical conversations for more information. And again, we hope to see you all soon again. Thank you. Take care.
Thank you, everyone.